Greetings, everyone. I want to talk about the functional effects of common cerebral palsy treatment methods. I'm Orsolya Gresits, as said, a full-time PhD student at the Department of Orthopaedics, and my vision about our healthcare system is that specific research results are implemented more quickly into daily clinical practice to provide the best possible treatment for our patients. I think my mission to achieve that is to contribute to high-quality research to improve cerebral palsy treatment. I have two projects in this PhD program. The first one is called The Efficacy of Upper Limb Botox Therapy Compared to Non-Invasive Treatment Methods in Cerebral Palsy. It's a meta-analysis. First, a nice slide about the pathomechanism of cerebral palsy. It's a neurodevelopmental disease caused by brain damage in the very early life stages. So this damage causes the primary abnormalities like abnormal muscle tone and muscle imbalance. Then, due to those factors you see in this slide, dynamic contractures, then static contractures, and finally disability, pain, and all those things come in the picture. The red ones are the treatment options in a hand of orthopedic surgeon. In my first topic, I want to concentrate in the first one, the Botox. Why is it important? Because cerebral palsy, as I said, it's quite common, and that's the leading cause of childhood disabilities. And about 80% of them has spasticity, which needs to be treated. One common treatment option for that is the so-called Botox injections. Fun fact, that's the same celebrities use on their faces. So they are used for temporary spasticity reducement in cerebral palsy as well. Recent studies find that they might have some negative effects on the muscles when they are used on the long run. And the functional benefits are not clear when they are used on the upper limb. That's why we aim to compare the effects of Botox and less invasive physiotherapies on upper limb function in cerebral palsy. My clinical question is about the efficacy of upper limb Botox therapy. My PICO consists of cerebral palsy patients injected with upper limb Botox and comparing them to placebo sham or any kind of physiotherapies. And we're interested in upper limb function measures like functional skills. Our hypothesis is that Botox will lead to improved upper limb function. Our study's potential clinical implications are to clarify indications of upper limb Botox therapies and hopefully to help cerebral palsy patients in their informed decision-making. We conducted our systematic search on the 18th of October. You can see the databases. We've searched the number of hits we got and my search key there. After the selection process, left with 20 full-text articles, and I'm doing the data selection on them right now. My second project's called Does Femoral Derotation Osteotomy Improve Gait in Cerebral Palsy? That's going to be a meta-analysis as well. The same structure I've already shown you, but this time, please concentrate on the bone surgery, like the FDO or the longer versions called femoral derotation osteotomy. You can see the basic concept on the picture. I want to point out that cerebral palsy patient will have fixed contractures and bony deformities in the long run. And that's when these invasive major surgeries comes into consideration, like the femoral derotation osteotomy, which is a common surgical procedure in cerebral palsy. It intends to treat the inward rotation of the hip, causing the so-called in-to-in gait. But what are the effects on gait? Does it worse to put the kids through those major surgery? We don't know. That's why we aim to clarify if FDO has a positive impact on the gait function or not. We're asking, does femoral derotation osteotomy leads to improved gait function in cerebral palsy? We're having cerebral palsy patients exposed to femoral derotation osteotomy and interested in gait improvement measures like gait scores. We presume that FDO surgery has a positive impact on gait. Potential clinical implications are huge because we want to aid orthopedics in setting up sufficient surgical indication for a major surgery, and also aid patients and their caregivers in reaching an informed decision about these surgeries. As an overview, I have two topics. They are both running. First one is about upper limbs Botox therapy. The second one is about femoral derotation osteotomy. I'm doing the data extraction in the first, and we are preparing the Prosper registration in the second project. And I have a quote from Jesus Christ. Truly I tell you, unless you change and become like little children, you will never enter the kingdom of heaven. Yeah, and thank you for your attention. And I'm glad to have any questions, if you might have. Thank you.
Congratulations. I just have a question to your second topic. Why did you choose patients under 18 years old?
Thank you for the question, because my supervisor is a pediatric orthopedic, and this procedure is used in the pediatric population. So, yeah, that's the reason. Thank you.
Thank you.
What do you think? Is there a difference between the female and the male population?
We don't know yet. We'll see.
Okay.
I don't think there will be any difference between them, but we'll see.
Thank you.